Premature ejaculation is a male sexual dysfunction that occurs when a man ejaculates in less than 1 minute, but he has to be bothered by this. If he's not bothered by ejaculating in less than 1 minute, he really doesn't suffer from premature ejaculation. Premature ejaculation affects roughly 20 to 30% of the population. We know that in some cultures they're more likely to have premature ejaculation. For example, some studies have shown that European countries have longer ejaculatory times. Some Asian countries have shorter ejaculatory times. The U.S., currently 24% of men suffer from premature ejaculation. The four main causes for premature ejaculation. There's the biological, neurobiological, genetic, and psychological. When we talk about biological, we're talking about disease states such as hyperthyroidism. In fact, some studies have shown that up to 50% of men with hyperthyroidism could have premature ejaculation. Neurobiological really refers to abnormality with serotonin or serotonin receptors within the brain. There's some studies that have shown that maybe there's a genetic role in premature ejaculation. But the most common belief is the psychological aspect. We believe that men may have low self-esteem, anxiety, depression, or problems with their relationship with their partner that may lead to premature ejaculation. I think it's important to have a very straightforward approach. I ask my patients simply, do you suffer from premature ejaculation? Now, many of them don't know what premature ejaculation is, so I ask them, during intercourse, do you ejaculate in a short period of time? If they say yes, the second question you have to ask them is, does it bother you? If it bothers them, then you have to figure out, is this lifelong premature ejaculation, or is this something that's acquired over time? So you ask them, when did it start? When did you first notice premature ejaculation? You also want to ask them if they have erectile dysfunction, because studies have shown that if a man has erectile dysfunction and premature ejaculation, you should treat the erectile dysfunction first. You also want to ask what kind of impact it has on their female partner. And finally, you want to ask if they tried any other treatments for premature ejaculation. You know, it's surprising, only 9% of men who suffer from premature ejaculation actually seek treatment. And what's more surprising is that of those 9%, 91% of them will say that the treatment they received did not help them at all. So I think most patients feel that it's a physician's responsibility to bring up the conversation of premature ejaculation. But when it comes to premature ejaculation, most physicians are not trained to discuss this topic. In fact, other studies have shown that up to 80% of patients who suffer from premature ejaculation are the ones that actually have to initiate the conversation on premature ejaculation. There are four treatment options for premature ejaculation. First is behavioral, which is where we teach the patient start-stop techniques or squeeze techniques. The second is antidepressants, whether they be SSRIs or tricyclic antidepressants. The third is use of tramadol or other off-label medications. And finally, using topical anesthetics, which tend to diminish the sensitivity of the glands, which have been shown to be very effective. You have to realize that a third of patients with premature ejaculation suffer from anxiety. These patients also suffer from depression, low self-esteem, low self-confidence. This also has a significant impact on the partner as well. It's also very difficult for men who are single that are trying to date because they typically try to avoid dating for fear of premature ejaculation. Typically, I ask patients to use Promescent 10 minutes prior to intercourse. I ask them to initiate anywhere from 3 to 5 sprays. But however, some patients may need to go up to 10 sprays prior to intercourse. I do ask them to wash off the spray prior to engaging in sexual activity. One of the main benefits of Promescent is that it's local therapy. It's not systemic. So in other words, these patients don't experience the nausea, dizziness, headache that you would experience with oral therapy. So again, I offer Promescent as first-line therapy to all my patients.